promised independence under the Jones Law of 1916. Progressive reformers saw the country and its people as a major target for modernization, and education was its main weapon. 7 forward-looking Filipinas came together in 1919 to create a school where young women could gain the knowledge and skills that would make them modern women. Paz Marquez Benitez was the first president of the Philippine Women's College. Jose Abad Santos was its first chairman of the Board of Trustees. Francisca Tirona Benitez was the second president, and with her husband Dean Conrado, guided the school from a house on A. Flores Street to its iconic Taft Avenue campus. In 1932, the college became a university, making PWU the first university for women in Asia founded by Asians. It provided a space where innovations in education flourished, and young people were encouraged to be the best that they could be. For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. Today's PWU offers undergraduate and graduate courses in several fields of study. Its business and management programs are responsive to the needs of industry, using evolving technology for global competence. PWU graduates excel in arts and sciences, education, social work, and diplomacy. Its fine arts and music programs have produced outstanding graduates through a holistic education that treasures heritage as well as excellence. PWU has pioneered in fields such as food science, nutrition and dietetics, medical technology, pharmacy, and nursing. PWU continues to play an essential role in producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
A safe and wonderful day from all our participants who are watching live right now. And to all nurses around the world. Welcome to the Philippine Women's University Dr. Philosophy Nursing. Nursing policy and ethics in the nursing. Today is the 6th and
a safe and wonderful day to all our audience around the world, especially to all of the nurses who are watching right now. Welcome to the Philippine Women's University Doctor of Philosophy in Nursing, Policy and Ethics in the Nursing Practice course. Today is the 6th of March 2021, streaming live in Doha, Qatar, via the Philippine Women's University Facebook page. I welcome you all to Nursing Policies and Ethical Dilemmas, where nurses stand and where they should be standing. I am Peach Del Sloyo, your webinar moderator. Well, the objectives of our activity are to discuss the leading ethical issues in nursing informatics, health-related software, and healthcare challenges regarding patient confidentiality. We will also determine ethical dilemmas and how the existing policies affect nursing practice. Further, we will dive in a scenario where we will discuss the common ethical issues experienced by healthcare workers throughout this pandemic. This activity starts at 1:30 in the afternoon and ends at around 4 o'clock in the afternoon, Philippine time. And to formally kick off, let us first start this activity with an opening prayer, followed by the singing of the Philippine National Anthem. I am aware that you have a lot to ask, and pretty sure that many more are to come during the end of the lecture. For us to learn and meet the objectives of this activity, let me gently remind you the following. First, for those in the Philippine Women's University Facebook Live, please type your complete name and your questions in the comment section, as our facilitators are readily available to answer your queries. Second one, I encourage you to sit down in a quiet environment where you are most relaxed and stop multitasking as much as possible. If required, use earphones or headsets. Third one, the evaluation link shall be posted in 3 ways. The first one is through your email. The second one is through a QR code posted on the slides at the end of the lecture. And the third one will be a QR code and link to be posted on the FB Live comment section. So everyone sit back, relax, and let us all enjoy learning. And in order to do this, let us call in Mr. Arce Amparo, the chairman of the organizing committee, to send his welcome address.
Distinguished guest, Mr. Marco Alfredo Benitez, Philippine Women's University President, Dr. Felina C. Yang, Chancellor and Senior Vice President for Academic Affairs, Dr. Minerva De Ala, Dean School of Nursing, our guest speakers, Dr. Jasper Tolarba, Mr. Jerome Okiana, and Ms. Lorelei Parsha. Ladies and gentlemen, thank you for being here with us today. Before we get started, I would like to express my sincere appreciation to all of you who are generously helped us make this event come together to become a success. We couldn't have done it without you. In today's gathering, we focus on nursing policies and ethical dilemmas. Have you ever asked yourself, where do I stand and where should I be standing when it comes to issues that directly affect my practice? We hope to help you find answers to these questions. In this time of pandemic, we are doing what we have been educated and prepared to do despite of the fear of the unknown that is present within us. We continue raising concerns for what lies ahead. We hope that the discussions we'll be having today will shed light on our anxieties. Let us learn from our renowned speakers whose expertise and experience are truly remarkable. Jot down notes and be inspired. More so, be challenged and be responsible as frontliners. I welcome everyone to the second leg of our virtual seminar. Let's keep in mind that we have the opportunity to heal the mind, the soul, the heart, and the body of our patients. They may forget our names, but they will never forget how we made them feel. This is Arce Amparo. A pleasant afternoon to you all. Thank you very much.
All right. Thank you, Mr. Amparo. Indeed, they will not forget how we made them feel. Well, at this juncture, let us hear some inspirational message to be given by no other than the president of the Philippine Women's University, Mr. Marco Alfredo Benitez.
Dr. Felina Yang, PW University Chancellor and SVPAA, Dr. Minerva De Ala, Dean of the PW School of Nursing, our distinguished speakers, members of the organizing committee, our dear faculty, students, and guests watching on our social media pages, good afternoon. I would like to thank the members of the organizing committee, Mr. Arce Amparo and Ms. Queen Yang Abdullah, for the opportunity to speak at this event and congratulate them for the timeliness and relevance of their topic, nursing policies and ethical dilemmas, where nurses stand and where they should be standing. Obviously, our world has been turned upside down the past year as a result of this global health crisis. With over 115 million confirmed cases and 2.56 million COVID-related deaths, the world has not seen a health crisis of this magnitude for the last 100 years. Arguably, no industry has had to bear the brunt of this crisis like you have, our nurses and doctors and other medical frontliners. And I would like to take this opportunity especially to thank all of you, whether here in the Philippines or whichever part of the world you are practicing. Thank you for your service and dedication. We all owe you a debt of gratitude. Today's webinar will tackle a wide range of issues related to ethical dilemmas in the field of nursing. These include appropriate and inappropriate use of information systems in healthcare and the government policies that affect them, common ethical dilemmas faced by nursing professionals, such as futile care or aggressive interventions, anti-vaccine issues, social media use, among others, and the laws and policies that affect actual practice. And last but not the least, the ethical issues experienced by nurses, particularly during this time of pandemic. These include nurses' professional responsibilities in treating patients when they themselves are at risk of infection, when to prioritize patient confidentiality versus the need to report cases to the public, and even the allocation of scarce hospital resources and treatments. It is our hope that this webinar will enlighten our audience on the challenges faced by nurses, at the same time possibly help practicing nurses make better ethical decisions should the need arise. As the world begins to see a light at the end of the tunnel, so to speak, with the arrival of safe and effective vaccines, there is renewed hope that the pandemic will soon come to an end. However, as you in the medical field know, a sense of complacency is also something we can ill afford to have with the proliferation of new variants of the virus. We will therefore continue to look to you, our healthcare frontliners, for guidance and inspiration as we navigate through this crisis. We hope that, as you have done for the past year, you will continue to be the shining example of resiliency, empathy, and dedication to service we can all look up to. So thank you once again for this timely webinar, and I look forward to a very informative afternoon. Stay safe and God bless.
All right, thank you very much, President Marco Alfredo Benitez, for sharing your words of encouragement. I believe that it would suffice the enthusiasm of our participants throughout the webinar session. At this point in time, I also would like to acknowledge the presence of the Board of Nursing who are watching with us right now live. Thank you so much, and I hope that we will learn something from this activity. This activity, the views, thoughts, and opinions expressed in the following segments belong solely to the guests and hosts, and not necessarily to the guests and hosts' employer, organization, committee, or another group or individual. You are still watching a live webinar activity broadcasted at the Philippine Women's University Facebook page, brought to you by the Philippine Women's University PhD Program for Nursing, Policies and Ethics in Nursing Practice. This webinar activity focuses on the policies and ethical dilemmas in the nursing profession. To begin with our activity, let me inform our audience that this activity has three main themes. First is the ethical issues in nursing informatics. The second one is the nursing policies and the dilemmas. And the third one is nursing ethics during this time of pandemic. Let me remind you that you are all free to post your questions in the comment section in our Facebook Live account, and questions shall be entertained at the end of each presentation of our speakers. And now, ladies and gentlemen, this is Nursing Policies and Ethical Dilemmas, where nurses stand and where they should be standing. And to have a glimpse of this webinar, let us all watch this video.
This webinar will revolve around nursing dilemmas and nursing informatics, COVID-19 pandemic, and nursing policies in addressing gaps in contemporary nursing practice. Nursing informatics has developed medical data and systems to support the nursing practice, to share and obtain care protocols and health records. In the advent of technology, is patient information fully protected? How does nurses sustain patients' confidentiality and privacy? While the pandemic has swept the world by storm and tested nursing to its very core, how does COVID-19 affect ethical decision-making? What are the nurses' professional responsibilities in caring for their patients and in sharing of information? Amidst all these, ethical problems for nurses arise in situations when decisions are to be made on life-sustaining treatment or intervention. But we may also ask ourselves, is this for the patient's best interest? Can nursing as a profession be able to develop sound and consistent guidelines and policies to solve ethical dilemmas? In these crossroads, where do nurses stand and where they should be standing? Join us as we go deeply into these topics. Let's start.
Live from Doha, Qatar, this is Nursing Now. Welcome to Nursing Now. When it comes to ethical decisions, nurses are often faced with a challenge because the right course of action isn't always straightforward, and the care choices aren't always ideal. In today's healthcare environment, ethical issues in nursing are becoming increasingly complex. Nursing ethics are important for upholding the nursing profession's reputation and ensuring better patient outcomes. To help us explore the different perspectives of nursing ethical dilemmas by sharing their experiences in their field of specialties, I have my two colleagues live from Studio 1 and Studio 9 with their special guests. Health Informatics studies healthcare information and communication, both of which have been greatly affected in recent years using computers and the web by both clinicians and patients. Many practices now use the electronic medical records and computerized provider order entry. Despite the benefits of digitalization, how can we ensure that we, as nurses, are acting ethically sound while implementing this kind of innovation? To enlighten us, we have Mr. Oliver from Studio 1 to interview Ms. Laureline Parsha, a clinical informatics system coordinator. Oliver?
Thank you, Peach. Good day, everyone. We are stoked to have with us today Ms. Laureline Parsha, Clinical Information Systems Coordinator. Before we dive in, Ms. Laurie, I'd like to ask, how are you?
I'm good. How about you?
I'm fine, thank you. Clinical Information Systems Coordinator. That's something that you do not get to hear about every day. Tell us more about your very unique role, Ms. Laurie.
Okay, well, the Clinical Information Systems Coordinator, particularly and closely working with the Health Information Management Service. And the primary responsibility of the Clinical Information System Coordinator is to ensure that the clinical documentation of the health workers, from physician to nurses and allied health, are accurately entered in the file.
Right, okay. That's one tough cookie of a job. Seems to me that you are indeed the perfect person to engage as to the many ethical issues that confront our nursing profession. Can you start, please, Ms. Laurie, sharing with us your, I perceive, very rich experience in this field, especially related to ethical issues?
Okay, so let me start out by sharing that according to the USF Health or Sani College of Medicine of 2020, they identified 10 issues related to the health informatics.
Right.
However, in nursing, the concerns are mostly focused on issues pertaining to privacy, confidentiality, and security of patient information, like the protection of private patient information, or liability of the nurses, user involvement, and accessibility, and last is the ethical dilemmas resulting from data availability and sharing.
Well, that's a lot of issues concerning ethics. Thank you very much. Just a thought. Is there such a thing as appropriate and or inappropriate use of health-related software?
Yes, there are lots of software application used in telemedicine, but they serve the same purpose.
Hi Rustan, good afternoon. My name is Dr. Connie Vendicacion. I'm from BTS Clinic. Is this your first time having a telemedicine appointment?
Yes, doctor.
One of which is the telemedicine, which according to the WHO is healing from a distance. This promotes accessible, cost-effective, and efficient delivery of care. It also allows healthcare provider to monitor patient in real time and adjust treatment plan as necessary. However, Oliver, there are instances when the use of such software can also pose risk to patient security, confidentiality, and privacy.
Now, can you please tell me your full name and health card number?
My name is Rustan Jeronimo, and my health card number is 1.
Besides, there are cases wherein telemedicine cannot replace the value of face-to-face consultation. For example, for patients with chronic conditions who requires comprehensive physical assessment. So when it comes to using technology in healthcare, the clinicians still need to weigh its risks and benefits.
And no one else can hear our conversation in my clinic. From your side, kindly ensure that you are also in a private place during this consultation.
So, as we can see, it seems that there are really lots of things that we should consider when we use technology. What do you consider of all these issues personally as top of your list?
Well, the security is linking with the confidentiality and
True.
the confidentiality and the privacy. So I would say that these three should come together.
And you consider these as the main stays of nursing ethical issues.
Yes, I should say.
Right. Okay. So going towards a more personal sharing, if you may, Miss Lori, have you been ever, or have you found yourself in a position during your tenure as clinical information systems coordinator, wherein your personal views or your ethics, had a clash with the tasks or the requests from your superiors or your higher-ups?
Yes, really I experienced that. However, if you know that giving information to the person is not allowed, of course you will not do that.
Of course,
And
yeah.
the good thing for us and the hospital that I am working, we are feeding with all the policies and protocols.
Nice.
So before you will make mistakes, you are aware already of the consequences of the action that you will do.
So there's a structure, there's policies, there's support
Yes.
from the leadership, the management, and the whole organization. Now the big issue, patient confidentiality. What threats, Ms. Lori, are the things that we need to anticipate or to be vigilant about in terms of nursing informatics? And what tips can you afford our audience to counter these threats?
Okay, so I will start with the confidentiality. Supposed to be only the patient is allowed to get her own information, right?
To access the information, yeah.
So if someone is asking to release the information of the said patient, we are not allowed to give any information unless the patient is minor.
True.
So the mother or the legal guardian is allowed to get the information of the patient. Aside from that, nothing else. Then one more thing regarding the privacy.
Right.
It is very common that sometimes we are receiving a call and asking, how is my wife, how is my husband, how is my mother, right?
True.
So the question is, are we allowed to give information to that particular guy who is calling? So my answer is, we shouldn't give any information, clinical information of the patient. Unless if the patient agrees that you can give information to my husband, you can give. But if the patient didn't agree, or the husband will use against her, we are not allowed to give. By default, we are not allowed to give.
Right. Okay. So it seems to me that in terms of confidentiality, nurses have to really be mindful as to their actions, and it takes, I perceive, familiarity with the policies of the organization as to, the release of information, how you share it, and all those. So there you go, ladies and gentlemen. We have to always consider these points when we are dealing, because actually we are dealing with patient information the whole time. Finally, Ms. Lori, in the context of this present pandemic, what practical strategies can we be readily implementing as nurses so that we can move above all these ethical, hula blues, if you may, with considering that during the pandemic, there's really a lot of dynamics and friction in terms of, the care, the release of information, all these stuff. So what are your suggestions or tips that you can give?
Okay, so now the very common now is the working from home. Because of this situation, some of our nursing leaders, they are working from home, right?
Right.
But even though you are working from home, privacy, confidentiality of information still need to be there.
Right.
One thing is, if you are using your laptop, make sure that you are placing the laptop or the computer in a place where no one can view except you. Okay? And then the strategies that I can offer is like creating a policy wherein the screen time, it will close within 5 minutes so that automatically it will close, no one can view.
Right.
And then one more thing is ensure that you are only using the laptop of the hospital that you are working so that it's easily to track down who logged in and who logged out.
Right. Very practical and yet very true. So I guess that's it for us. Thank you so much, Ms. Lori, for your time, for sharing your experience. And there you go, Peach. This is, again, Ms. Lori Lynn Parsha, Clinical Information Systems Coordinator. Back to you.
Thank you, Oliver, and to Ms. Laurelyn Parsha. Truly, nurses face ethical dilemmas daily, no matter where they practice. Nursing information technology and healthcare are going hand in hand these days. The universal impact of technology in healthcare has created a new role for nurses. Thus, information is a powerful tool and a key to promote safe, high-quality patient care. We will be right back. Welcome back. This is Nursing Now. COVID-19 has brought to the fore a range of ethical issues affecting individuals and organizations. At this point in time, many of us are asking how ethical principles are being applied to the current scenario, where COVID-19 is on the surge. Healthcare workers might be asking, are there new guidelines ethically sound and morally acceptable? And how do nurses practice ethical decision-making during this time of pandemic? To answer these questions, we have Nashreen live from Studio 9 with a special guest, Mr. Jerome Okianya. Nash?
Thank you very much, Peach, and hello, everyone. The COVID-19 pandemic has highlighted many difficult ethical issues that nurses face when caring with patients and families. And the decisions healthcare workers face in the front lines is fraught with too much uncertainty. We are very lucky to have with us today one of the managers and the team leaders in COVID-19 response and one of the first frontliners who manned the largest quarantine facility in the country, Mr. Jerome Okianya. Good afternoon to you, Sir Jerome.
Yeah, good afternoon, Nash. Good afternoon for having me here. Thank you very much.
Okay, to start today's very good interaction, can you just share to us some of the highlights of your experiences while being assigned in the COVID-19 facilities?
Okay. So Nash, during the height of the pandemic, we were called. I remember the date, it was March 12th when we were activated. And we were called to one of the quarantine facilities here and was instructed by the ministry to man again the quarantine facility because we're having a lot of positive cases. This is the start already of having a lot of patients. So there were a lot, as you mentioned, there were a lot of uncertainties. So we do not know exactly what to do. There were a lot of questions that as staff we were a little bit worried, a little bit confused, and of course we exactly don't know what we will be facing in this duty. So it is a regular assignment for us, but the true highlight I can say is the teamwork and collaboration between the government agencies as well as the different health facilities here in Qatar, where we collaborated and worked together in the battle against the pandemic.
So, Jerome, it is really good to know that collaborative efforts were in place during that time. So, if I may ask you, what are the responsibilities of you as a manager of the quarantine facility during that time?
Okay, so my roles and responsibilities include, of course, the managing the nurses and managing the facility itself when we talk about, let's say, about the materials, about how to maintain the place, and of course the welfare of your staff. I have to make sure also that the roles and responsibilities of the nurses are followed. So the typical roles of the nurses, of course, is when I say typical, it's just admitting the patients, assessing them on their condition, evaluating them day by day on what is the progress of the disease and what's happening to the patient and listening to their concerns. So in general, it was at first like a routine work, but the developing circumstance every day is again uncertain. There were a lot of problems, there were a lot of issues that we were facing. And one highlight, I think, that I can say about the responsibility of the nurse is we became the voice of those who doesn't have a voice.
So earlier today, I got the opportunity to talk to Jerome about real-life experiences in the front lines. And you have mentioned to me, Jerome, that some of your patients were in the quarantine facilities while their families are admitted in the hospital. And even worse, some of them had their families in the hospital who died during the pandemic, while most of your patients were very much in a dilemma on what they will do since they lost their jobs and they don't have enough money or even food when they go out of the facility. So this is really very alarming, Jerome.
Correct. So when we talk about these cases, we really don't have any answers. Like what I said, when the pandemic started, there's a lot of questions that remain unanswered. But the good thing about that is we already talked to our superiors. We were telling them and suggesting a lot of things to improve the conditions of the patient as well as to answer their concerns. So ethical dilemmas cannot be avoided, especially when it comes to the patients. They have some concerns that you will try to find a solution, but you cannot because you have your limitations. There are some rules that are being mandated by the government, and you have to follow them. When you talk about the nurses itself, they were also having concerns whether they're really fit for the job or are they really doing what is right. So like for me, I was telling them as a manager that it is a call of duty for us. It was a sworn oath that you have to be here in the quarantine facility because what you're fighting for is not about yourself only. You're fighting for your family, your friends, and you're making a line and protecting the entire country. It's not only the country that's experiencing it, we're experiencing it around the world. So being a nurse and having the pledge when we graduated at school, it remains as an inspiration for the nurses to at least forget about their questions and continue doing their roles and responsibilities and maintain that this is really their job, and they really need to make a stand.
So based from what you have said, being there physically and emotionally ready, you were ready for anything. But what about your nurses? Were they ready, same like you are?
Some nurses are willing. Again, I would like to emphasize the word willingly. They were willing to go on duty because they took it as their main responsibility as a healthcare professional. But some were afraid. Some have their concerns. They were thinking about what will happen if they go to the quarantine. How about their families? Will they be the source of infection? They have concerns where they were being shunned by their friends because maybe they're bringing the infection back to the communities. They're also concerned about, am I really doing what is right to the patient? When you think about your limitations, for example, when we talk about the use of PPEs, there was a situation before wherein the hazmat suits were low on supply, and I told the nurses use the isolation gowns while maintaining the infection control guidelines. And then these are the things that they were thinking about, and they were asking, am I really fit for the job? And we always remind them again that whatever limitations you have, you still have to perform your duty because it is mandated by the government, and we as nurses are supposed to be there.
So we are acknowledging that there was a shortage really of PPE not only here in the country but also globally. So what were the steps that you have done during that time in order to overcome the challenges when it comes to protecting the staff in the front line?
Okay, so when we talk about the scarcity of resources, you are not talking only about PPEs. You have shortages with medical or non-medical items. So medical items, again, PPEs, scarcity of the beds, isolation facilities are running out of spaces. Hospital beds are also running out of spaces. ICUs are full. There were even reports coming from different countries, such as the US. They were enforcing the nurses to reuse N95 masks when typically it's only used once. In Korea, there was reported news wherein people are dying at their homes because they were waiting for admissions while the hospitals were declaring there's no more beds available. In Mexico, there was a report of having no oxygen tanks. Imagine you're having respiratory problems and there's no oxygen tanks in the hospitals. So in a typical aspect of saying the problem is global. And we try to think about the ethical considerations when we talk about scarcity of resources. So imagine you don't have enough things to use for yourself, to protect yourself, as well as you don't have enough capacity to provide the proper service to the patient. So there's mistrust. There's a lot of mistrust. Patients will question, are you really giving them the service that they deserve? Are you really using the correct materials for them? There's also the concern of the nurses or the healthcare professionals when it comes to bias and prejudice. Will I use this item in patient A? And will I also use it in patient B but not in patient C? When you have bias and prejudice, then you have the moral distress already. Am I giving enough for this patient, but I'm not providing enough service for this patient? So moral distress is caused primarily because of the scarcity of resources, and it leads to a lot of more ethical issues.
So you have mentioned to us two very important points. One is the ethical implication of scarcity of resources and moral distress. So if I may ask you further some questions, what about if a patient dies? What will happen, Jerome?
When you talk about deaths related to the pandemic, you have three groups of people that you have a major concern. So the first one is the patients. So imagine at the height of the pandemic, you don't understand what's happening, and you get tested, you become positive, you're being picked from your house, you go to the facility without even properly saying goodbye to your loved ones. And then it comes to the point that you became worse in your condition, and you feel that you're dying, but you don't also have the chance to, again, hug your loved ones. You even don't have a chance to talk to them. So it connects to your loved ones, the family members. Earlier when I said the patients were taken from their houses and they don't even have the chance again to say goodbye. They don't also know what's happening with you in the facility. They were probably calling the facility, and because of a lot of patients being admitted, they don't receive the proper response. So now they're confused, they're irritated, they're angry. And finally, they receive news that their loved one died in the hospital. So again, it causes stress to the community itself. And you talk about the last group, which is us, the healthcare professionals. When a patient dies, we again question ourselves, did we really do what we're supposed to do? Did we provide whatever things that the patient really deserves? So it goes to the point wherein we experience also firsthand deaths in the quarantine facility. So the best thing that you can advise also when it comes to death in pandemic, like there are a lot of improvements now that's happening. Now that the telecare medicine is there, there was already a chance for dying patients in the hospital, in the ICUs. They're being given a chance to talk to their loved ones, just to say the last goodbyes, probably. So you also have to consider confidentiality side of things. For example, the patient dies, so do we really need to divulge the data? Or when a patient gets admitted to the quarantine facility, we were taught before when we were in school that patient confidentiality and privacy is one of our priorities. We need to protect the patient's privacy.
Thank you very much, Jerome, for sharing your insights. Definitely, the experiences of healthcare workers like you will be part of the books, will be part of history. Before we finally end this talk for today, do you have any message for our viewers who are with us in this live event?
Thank you, Nash. So I would like to take this opportunity to thank all nurses and healthcare professionals who were brave enough to battle this pandemic. So we were given a chance to help our nation, and you were given a chance to prove to the world what nurses are.
We have heard a lot of stories, yet there are still so many questions left unanswered. This is Nashreen, and back to you, Peach.
Thank you, Nashreen, for that very informative interview with our second guest, Mr. Jerome Okiana, Chief Nurse, Qatar Red Crescent. We have learned that ethics in the time of pandemic plays a significant role in whatever decision we make, considering that we are overwhelmed with various issues that affect our decision-making process. That was Nashreen from Studio 9. Thank you very much. Contribute to creating a culture of ethical practice in your workplace. Participate in workplace committees or initiatives that foster a culture of change and professional organizations to advocate for system change. And this has been another fruitful conversation. And we will see you on the next episode of Nursing Now. And that was our guest speakers live from Doha, Qatar. Okay. So here we
Are the two guest speakers.
and Mr. Jerome Buchanan. Welcome to the show.
Thank you.
How are you doing? Okay. Actually, guys, for the information of everyone, they are PhD students, all right, at Philippine Women's University, and they go with the challenge. You are still tuning live to Nursing Policies and Ethical Dilemmas, where nurses stand and where they should be standing. Right now with me live here in Doha are our two resource guests. Actually, they are PhD students learning at the Philippine Women's University. Let us welcome Ms. Laureline Parsha and Mr. Jerome Okana.
Thank you.
How are you, ma'am and sir?
We're good.
Very good.
All right, that's nice to know. So we have some questions to you coming from our audience. Okay, but before anything else, we would like to acknowledge the presence of Dr. Gloria B. Arcos, the Board of Nursing. Welcome, ma'am, to our show. Okay, so the first question is coming from one of our audience. Okay, so the question is directly towards Ms. Laureline Parsha. Okay, the question is, because Ms. Laureline, you have mentioned a while ago regarding privacy, security, and confidentiality of patient records in terms of the health information, right? So are there ways that this information, quote unquote, be waived? Are there any considerations for that matter?
Yes.
I'll give you this one.
Yes, so in my discussion earlier with Oliver, I stated that the release of information should be given only to patients, parents, or the legal guardian if the patient is minor. And there are cases also wherein we can release information to court or sometimes in the research purpose.
Okay.
So the reason that we are giving information to court is because the patient file is also a legal document. So
Okay.
it is being legal because the content of the information inside are concise, accurate, and consistent.
Okay.
So if the court is asking for the release of information of a certain patient,
Nina, for example.
yes,
Okay.
for a certain patient, then it is permissible to release those information. One more thing regarding the research. Research for research purpose. Yeah, we are allowed to give, but we need to keep in mind the two ways. So first is if the patient is involved and the patient need to have a series of interviews, then we need to acquire for a consent.
Consent, yes.
Yes. If the patient also is not involved and only we need the data, then that's the time that consent is not required.
Okay, so you need to say that these can be waived in terms of, number one, a subpoena from the court.
Yes.
Or order, and the next one would be research. And the other
Purpose.
one is for what? The minor is saying?
Yeah, that is default already. By default, only for the patient and the relatives
Okay,
or minor.
so that was clear, ladies and gentlemen. I hope we answered your question. And now this question is coming from one of our participants to Mr. Jerome. Hi, Sir Jerome. How are you? How are you doing?
Thank you.
Okay. So there is a question here, because you mentioned a while ago regarding the shortage in the time of pandemic. So we can see that there's scarcity of resources, etc. What if, for example, there is a scarcity in terms of life-saving equipment, for example? So how do you handle this matter?
Okay, so when we talk about the scarcity of resources, there were a lot of policies that were made during the period of the pandemic. It's until now the policies are still being developed. So there was one organization, the Massachusetts Medical School, which they published 4 principles, which states that if you have scarcity of resources, you can follow 4 principles. So,
4 principles.
yeah, so the first principle is maximization of the benefits. So when you say maximization of benefits, you try to save as much lives as possible.
Okay.
The second principle would be treating people equally. So when you say treating people equally, there are 2 choices. Either you go with the first come first served basis, or you do random selection like a lottery. When they studied it, they said that random selection by lottery is more fair, because considering that you have first come first served basis, those who are living near the healthcare facility would receive it sooner than those who are living far.
Alright.
So random selection such as lottery would be fair.
Okay.
The third one is priority for the worst or the best. That's why in the vaccination, we choose, for example, who will you vaccinate first? The youngest or the oldest, the sickest first, or those who have a higher chance of survival. And the last principle, of course, is instrumental value. Instrumental value reflects for those who you give the resource, for those who can give back more. For example, N95 masks are given primarily to healthcare workers, because imagine if your healthcare workers are sick,
Yes.
who will take care of the sick people? There's also one point where there's, Lori mentioned before, it was also correct, that there was a reward system for those people who voluntarily submitted themselves for research.
Okay.
So for example, I told myself, okay, there's a research for the vaccine. They wanted to test it for me. So I would volunteer myself there.
So you become a respondent there.
Yeah, so when it comes to scarcity of resources, you are just given a reward and you will be prioritized first.
Oh, right. Well, those are just new ideas.
Yes.
And I call it evidence-based.
Yes.
That was published in the Massachusetts Medical School New England Journal. Okay, so just to summarize what you said, Sir Jerome, so in terms there are scarcity of resources, there are 4 points you mentioned.
Yeah.
Number 1 is maximization of benefits. Number 2 is to treat people equally, maybe random selection or by first come, first serve.
Correct.
But you have said a while ago that random lottery is the most common.
Yeah.
Fair enough. Okay. Next is the priority for the worst and instrumental value or the reward system. So that's it, ladies and gentlemen. So thank you so much, guys, for your time, for sparing your time and effort. I know you are busy of demanding schedules, but thank you for being here, Ma'am Lori and Sir Jerome.
Thank you.
Okay.
Thank you.
So we just had a glimpse of what this webinar activity is all about. But at this point in time, we will be knowing about the current issues in nursing, where nurses stand right now and where they should be standing. All right, to inform us of our next resource speaker, let us welcome Ms. Connie Vindicacion, nurse educator at the Nursing and Midwifery Education Department, to welcome the next key resource person. Ms. Connie.
Dilemmas are very common in our ever-dynamic and continuously evolving nursing profession. Although these challenges may be difficult, they obviously enrich our knowledge and skills as well as improve the quality of care that we deliver. Today, I am pleased and honored to introduce to you our beloved guest speaker, who is a global leader and an expert in the topics of quality nursing education, nursing mobility, migration, and nursing curriculum evaluation. He was a former faculty member at Bicol University, Legazpi City, where he received both his Bachelor of Science in Nursing and Master's in Education. He is a full-stop nurse leader with more than 20 years of nursing experience in varied and progressive roles. His prior clinical experiences include working as a director of nursing at Tufts Medical Center in Boston, Massachusetts, as a patient services manager at Yale New Haven Hospital, Connecticut, and as a nursing supervisor at St. Mary's Hospital, Waterbury, Connecticut. Our speaker also worked as an adjunct professor and instructor in Illinois and Massachusetts, and is a recognized resource speaker in several national and international conferences with several publications. He is a 2019-2020 U.S. Fulbright Scholar and conducted a national research in the Kingdom of Jordan for 7 months. He's also an inducted member by Sigma Theta Tau Delta Mu chapter at Yale University. In 2007, he received his Master of Science in Nursing, major in Nursing Administration from Xavier University in Cincinnati, Ohio. In 2015, he completed his Doctor of Nursing practice with specialization in health policy and executive leadership from Yale University, New Haven, Connecticut. His enthusiasm for professional development is truly impressive and inspiring because currently he is pursuing his second doctorate degree at Teachers College, Columbia University in New York, New York. As a global leader, our distinguished guest speaker joined CGFNS in 2016 as the Director of Credentials Evaluation Services. In his current role as the Director of Global Standards and Qualifications, he is responsible for defining and achieving the development and implementation of CGFNS standards and policies consistent with the strategy defined by its President and CEO and Board of Directors. In addition, with his strategic and vital role, he leads CGFNS programs around global standards and qualifications for health professionals in collaboration with international leaders in the fields of education, regulation, accreditation, and practice. Knowing about his remarkable portfolio makes you proud to be a Filipino, right? Well, I believe that just like me, you are all excited to be inspired and to know more about our highly respected guest speaker for today. So without further ado, ladies and gentlemen, with great honor and pride, please help me welcome the Director of Global Standards and Qualifications, Dr. Jasper L. Polarba.
Hello. Hello.
Yes, doctor, please continue.
All right, cool. All right. Good afternoon, everyone, and I am delighted to be part of this webinar. And thank you so much for that generous introduction. Do I share my screen now?
Yes, please, doctor.
Right. All right. So thank you so much to the organizers of this valuable seminar this afternoon or morning, wherever you are in the world. And I'm truly honored to be part of this continuing education seminar. And I know that we would rather meet in person in a traditional setting, but I hope that you are all okay and safe wherever you are located. And again, thank you so much to the organizers, to the PhD students of the Philippine Women University, and also to the faculty members, the dean, the president. I would like to also acknowledge the presence of the members of the Philippine Board of Nursing, members of the faculty. I have invited quite a few of my colleagues, myself, from Jordan, from Saudi Arabia, from the Philippines, and the US. So thank you so much for having me, and I hope that through this 1 hour talk, I would be able to share some of my knowledge about this topic. But before I continue, I would like to provide some disclaimer. Okay, so I do not speak for any employer or organization. I have no conflict of interest to declare in this presentation, and obviously I will not be providing any legal advice during this presentation because I'm not a lawyer myself. So with that said, let me
Sorry to interrupt you. Yeah, can you please share your screen to us so that our viewers can see your slides?
Perfect.
All right, thank you.
All right. Are you able to see my screen? Hopefully, you're all seeing what I'm. My first slide. Okay, thank you.
Yes.
All right.
Please proceed.
Sure. So as I mentioned, I have a lot of gratitude to the organizers of this webinar because I think this is a very timely topic considering what is going on in the world right now. And I'm actually glad that somebody already tackled the topic about the pandemic because that's a whole discussion in itself. I probably would not be able to cover the whole thing. So today I'll just be focusing on ethical dilemmas in nursing practice, and our objectives for this talk are the following. We will be able to discuss the various principles and nursing policies related to healthcare ethics. We'll appraise some scenarios depicting ethical dilemmas that happen in clinical settings. And finally, we'll attempt to explain the role of the nurse when faced with an ethical dilemma. So one may ask, why does it matter? Why does it matter to me? Why does it matter to you? As a professional nurse and as a person, right? Personally, I really got interested in this topic because I've been, a nurse for a couple of decades now, and I have, I've been privileged to practice in different settings, long-term care, nursing home, school nursing, critical care, rehab. You name it. I probably had the opportunity to do a few of those experiences myself. And it doesn't matter what setting you're practicing. There's always going to be a situation where you ask yourself, boy, that was a difficult experience. I wish I was able to do something different. And when that situation happens, you're probably faced with an ethical dilemma. And studies have shown by Russo actually found that neither the patients nor clinicians and even nurses are well equipped to address these dilemmas today, these ethical dilemmas. We are not really prepared on how to act or how to to behave in certain situations, in these difficult situations. And the problem, the issue with not doing what is supposed to be done in this situation is that our actions as nurses are directly impacting the quality of nursing care provided to our patients. So our lack of actions, lack of advocacy for our patients, actually obviously will directly impact the outcome of the care for the patient. And in fact, we all know that every nurse, we have been taught in nursing school that we are accountable for the knowledge that we have and applying those skills that we have in caring for our patients. So that is why it is important to really know about this topic that we're talking right now. Now, ethical dilemmas, as I've already mentioned, frequently arise in attending to patients, right? So when you go to your work settings, there's always situations where you're going to ask, like, what I'm going to do? It seems like there's no right solution to the issue that I'm facing for this patient. And when you're in that situation, it creates a lot of moral distress. You go home and you feel like you have not done something right during your shift. You feel that you failed your patient, right? And you're not able to sleep. You're not able to, focus. And that's called a moral distress. And every nurse, and in fact, every employer should be able to recognize that these are potential problems for the nurse and for the patient. And it creates a harmful effect, right, for you as a person and also for your family members. You go home and you really are not talking to your wife or to your husband or even your children because you're really bothered about what happened at work. So this creates a moral dilemma and moral distress on your part. So before we proceed, I think it's important to put definitions to our topic today so that we'll be able to really talk about clearly on what we have at hand. So nursing policy are decisions or plans and actions that are undertaken to achieve specific healthcare goals, right? And then with nursing policy, of course, we'll have some nursing guidelines on how to implement those plans and actions. Ethical dilemmas, I've mentioned, are those situations which are really difficult, and every action has, a different outcome. And either of those outcome have transgressing moral principle. So there's really no right or wrong answer. And when those ethical dilemma arise and you're faced amidst that situation, you're questioning yourself, like, what is the right and what is the wrong thing to do? And the problem with ethical dilemma is that it seems that in that situation, there's really no right or wrong answer. So we're always used to, as people, it's our human nature to think that there's always like, oh, this is the right thing to do, this is, the wrong thing to do. But with ethical dilemma, it's almost like a conundrum, right? That it is a situation where there is no wrong or right answer at that point, and it seems to be simple, and yet you cannot put your fingers on it. So it creates a lot of, mental disturbance. So what guides our actions in this? When nurses are faced with those situations, what guides them to do or act on those ethical dilemma? What prompts them to do something, right? So let's look at the different ways or different reasons, rather, on how nurses respond to ethical dilemmas. Nurses sometimes act based on their personal moral views. So, as you know, values are your own set of principles as a human being, as a person. Your belief are your ideas that you think are true, but you really don't have any facts at hand. And your attitude are what your upbringing is, from your experiences as a child and growing up as a person. So nurses act on this ethical dilemma through personal moral views. The problem with acting on personal moral views is that you as a person has a different personal moral views on another, because you yourself is a unique person, right? You have a unique experiences, you have a unique background, so your personal views may be what is true to you but might not be true to me or your colleague. So that's the problem with relying on personal moral views to act on ethical dilemmas, because we have different personal moral views as human beings. The second, reason on how we act on ethical dilemma is organizational ethics. So the good thing about organizational ethics is that it guides us on what to do. It tries to put a standard of practice to every individual, acknowledging that we have different personal differences. So our organizations, individual organizations, create their own organizational ethics. So when you go to your work, you have your own mission, your trust, your goals, your ethics as a company, right? Wherever I work, we always have that own mission and vision and what's acceptable or not in the workplace. So in this way, we have a guide on how to act in our workplace. But then again, every organization has its own different ethics and beliefs, missions and visions. So, and that is why you probably jump from one organization or one company to the next, because you don't feel that your core values are consistent with that organization's ethics or core values. So the next reason or the next guide where nurses act is our code of ethics. Nurses as professionals have created code of ethics, right? Now, every professional organization in every country created their own. I know in the United States we have the American Nurses Association's code of ethics. In the Philippines we have our own. In Saudi Arabia, in Jordan, wherever you are, every country had created their own code of ethics. But for purposes of this presentation, I actually chose the International Council of Nurses, because they are the body of organizations that comprise 130 plus different professional organizations of nursing. So I chose them just to be sensitive to the presentation, knowing that we have different audiences this afternoon coming from different countries. So in terms of the code of ethics that ICN has purported, they feel that nurses and people are that nurses' primary professional responsibility is to care for our patients, right? To really focus on the people that we care. So that's the number one code of ethics that the ICN really promotes. The second is that the nurse carries personal responsibility and accountability for our own nursing practice, and we as nurses we should maintain our own competence by continuous learning. That's why we are having this webinar, and your attendance actually demonstrates that you are following this code of ethics for yourself. You're trying to learn more about and to be updated about this particular topic, so that you will maintain your own competence when you care for with your patients. The third one is the nursing profession, where the nurse assumes the major responsibility in determining the acceptable standards of clinical nursing practice. So as a profession, we really should not be looking at other professions to dictate what our professional practice is. I know that it's always been a perennial problem anywhere you go in the world in terms of nursing, because we are not part of, you know, the decision makers. Recently, I could speak in the United States, you know, in this pandemic, you know, they created this COVID-19 committee to oversee the plan for action on how we're going to tackle the COVID-19 pandemic. And then initially there was like, you know, 10 members, and yet there was no nurse in the group. And then when we called them out, now there's one nurse that was represented, but one nurse out of 10 is even acceptable, because if you remember, nurses are the largest healthcare professionals in any healthcare settings. Even if you combine, you know, all the different professions, doctors, physical therapists, they would still not exceed the amount of nurses, the number of nurses that you know, work in the healthcare setting. We're more than half. So we need to be able to dictate our own practice, right? Our own competence. And last but not least, we need to sustain collaborative and respectful relationship with coworkers and also other healthcare professionals in the field. So this code of ethics should also guide us in our practice when dealing with ethical dilemmas. The fourth, you know, default for dealing with ethical dilemma is regulatory requirements. And when I say regulatory requirements, I'm talking about, you know, your state board of nursing, putting all the regulations on how a nurse should practice in their jurisdiction, right? So I'm glad that the Philippine Board of Nursing is actually here, because they are a really critical and vital body into guiding the practice of nurses, especially with dealing with ethical dilemma. And I must mention that every jurisdiction, every state board of nursing, you know, has their own rules and regulations in terms of their rules and guidelines in the nurses' practice. And last but not the least are local, state, or federal and national laws. And I think it's self-explanatory that, you know, as a profession, we are always guided by the laws of the land, right? Wherever you are in the world, you always have to know the laws that limit or guide your practice. Remember the old adage saying that ignorantia legis non excusat. So if you do not know the law, it does not excuse you from the accountabilities of practicing as a nurse. Now, I'm always big about evidence-based practice, and that is why when I was invited to look at this or present this topic, I, you know, immediately went back to the literature and really find out what's going on out there in the current world in current setting in our practice. And I found I really highlighted two studies in this literature, right? So the first one is the one published in 2018 by Rainier and others, where they looked at different researches from 2000 to 2017, and they had looked at about 72 studies, and they retained and examined 35 of those studies. And out of those 35 studies, they have summarized what are the current ethical dilemmas experienced by nurses in the workplace. So I have highlighted them here. The first one is end-of-life issues, right? So that's on top of the totem pole. Like every nurse experienced an end-of-life issues, a dilemma. The next one is conflict with physicians and or families, right? So we are always at the forefront with the family members. How do we deal with them? How do we interact with them? How do we guide them on those difficult situations? Of course, conflict with physicians. I myself have, had incidences myself with physicians asking me to do things that I don't feel that I should be doing, and you should be able to, put limits into what you would do that physicians asks you to do. You should be able to advocate for your own self. And then patient privacy, I can't even talk. Privacy concerns, and I'm glad that the previous speaker actually had discussed this, right? About telehealth and what are the things that could be shared and could not be shared to the world. So you have to be really careful about, HIPAA policy and personal health information. And then organizational constraints. What are the things that our organizations can do, cannot do, resources, etc. So those are the things that nursing or nurses right now are experiencing in terms of ethical dilemmas. However, we should not forget the ethical dilemmas also experienced by our students. I know there's a lot of educators listening right now, and I think it behooves us as nurse educators. I'm a nurse educator myself, and I always try to advocate for my students, as I know most of you here do. And we need to really also highlight what are the ethical dilemmas experienced by our students. And then again, I went back to the literature and found a study done by Albert etc. in 2020, and they looked at about 1,000 studies and retained about 13 of them and examined them and came up with the themes that are experienced or ethical dilemmas experienced by our students, our nursing students. The first one is applying learned ethical values versus accepting unethical practices. So we, in the classroom, we educate them about, different ethics, different moral compasses, and how to, act professionally, etc. But still, when you ask your students, they don't feel that what they learned in school, in classrooms, are acceptable or can be applied to the work setting. So that's one of their dilemmas. And the second one is deciding to provide ethical care but lacking autonomous decision making. And for obvious reasons, there are students, they don't have licenses, so they don't feel empowered to really advocate or act on the things that they feel that should be the right thing to do because they think that they are just students. So that's one of the ethical dilemmas and moral distress that our students, our nursing students experience. And last but not least, the experience of just keeping silent, or do we tell somebody about neglects, right? I have had, clinical mentoring. I bring students to the medical, floors, and, students are afraid to tell you that, this nurse so-and-so on the floor did something that really hurt the patient. And they feel distress that they should even tell you as their clinical instructors. So these three are the biggest moral dilemmas that our nursing students are experiencing. And that is why I would like to, for those nurse educators out here, should also be cognizant about this study findings, so that when you go back to your classroom and your clinical sites, you should really encourage your students that, yes, I'm aware about your situation, your predicament, and encourage them to really talk and discuss with you about these things. And I really like about studies on systematic reviews, because they do not just look at one study, two studies, but they look at the studies from from years, and then compile them and find different common themes from different studies. So I really like systematic reviews, because those are evidence-based practices. So I would like to also highlight, and I know that you probably would say, well, here we are again with this principle of healthcare ethics. It's very what do you call that, basic. But I think it's always good to always go back to the basics, right? Because these are fundamental anchors, or this serves as our moral compass as we deal with ethical dilemmas. We'll talk about autonomy, right? That means that we respect the freedom of our patients or our family members, and let them choose the right thing for them, right? They should be able to decide what is good for them. And non-maleficence means you should not do anything that will harm your patient, or if you are left with doing an intervention that it's harmful, that at least you try to minimize the outcome or the effects of those interventions. Justice is to actually treat your patients and your family members, family members of the patients, quite fairly. When I say fairly, I do not mean that you should treat them equally, right? To give you an example, how about like triaging, right? So in the emergency room, justice means you do not prioritize all of the patients, but you actually triage them on who needs the care most out of the patients that's in your emergency department. Another example I could give for justice is organ transplant. So you have people on lung transplant, and there's one available organ that's made of that's all of a sudden is free and ready to be transplanted, and out of your 100 patients on a lung transplant list, who would you choose from those, right? So that's what I mean by justice. Although you treat them fairly, but it does not equate to treating them equally because of resources issues. And last but not least, as beneficence, that means that what is good for your patients is what you really wanted to do. I would not belabor this because we are all nurses here, and I'm sure you have had discussed that basic healthcare principles in nursing school. But what I would like to highlight really is that out of these different healthcare principles, autonomy, beneficence, non-maleficence, and justice, the issues with healthcare ethical dilemma is that these principles are often in competition with each other. So in today's healthcare world, there's no single thing there's no one right single thing that will address the problem, right? It's very complex, and the approach should be different on different situations. So now I really would like to provide, and I hope we don't run out of time, and depending on my time here, I have few videos here, but let's see how our time allotment is. But I would like the organizers to share their screen, because I would like to provide a video, and I think they will be able to share their video instead of myself, because I think the last time it didn't work. So Connie?
She's moving her entire body. She's not just moving the lower half. She's moving her head. She's moving her arms. She's moving her legs, her feet, everything. So yeah, definitely.
It's been well documented on cell phone videos like these and witnessed by family, friends, nurses, even physicians. But doctors today told the court these aren't signs of life, just leftover reflexes. They're inconsequential because they don't represent anything in the brainstem or higher. We don't think that because they have spinal reflexes that they have consciousness. Dr. Andrew Baker, a neurologist who helped to define neurological death in Canada and the criteria for establishing it, told the court.
Move it again, baby.
He says that it's a phenomenon he's seen several times before, but not on patients that have been declared dead for so long. He concedes there aren't studies on patients like Takesha. There are not papers published on chronic patients, that's weeks and weeks, that have been receiving somatic support after being declared brain dead, he told the court.
Good.
Most studies say these movements are not witnessed 72 hours after death. Admitted to Brampton Civic Hospital on September 14th, suffering from a drug overdose, Takesha has never regained full consciousness. But her family says that doesn't mean she's dead.
What are you scared of? What are you scared of? So these questions have to be answered. They know that we know the truth. And the truth is that those are not automated reflexes. Those are actual movements that are stimulated by our voices, by our touch.
All right, thank you so much, Connie, for sharing that video to us. So as you can see, in this ethical dilemma, am I presenting? Is it?
Yes, doctor.
Good. All right. So in this situation, in this ethical dilemma, it's really a predicament where the family is thinking that their family member, in this case the patient, is still alive and shows signs of life because the patient is moving. But on the contrary, the healthcare providers are pretty adamant that the patient is already brain dead. So what do? Do you pull the plug on this patient? Does the patient continuously being supported with a vent or life support? So I myself have been working in critical care, and I could say I've been in that exact situation for twice of my patients in the ICU, and I remember feeling at that point kind of helpless, because at one point I'm with the family, I'm interacting with the family, I'm caring for this patient who, if you look at the patient, it's perfectly normal. The vital signs are beautiful. You look at the patient, patient is actually moving, but biologically there's no brain activities anymore. So it's signaling a false hope to the family in these situations. But as a nurse, if you do not know this ethical dilemmas, you might feel distressed, and you go home and feel like you feel guilty, right? Because you didn't advocate to the patient. Sometimes I remember feeling upset with the doctors for even considering pulling the plug for the patient, for my patient, which I have been caring for several weeks. So at this juncture, I actually would like to ask you, the attendees, the participants, to let us know, if you are in this situation, what would you do? All right. If you are the nurse caring for this patient, what will you do? What's your take about this whole ethical dilemma? What you will see in the screen is a QR code, and I would like you to use your phone to actually scan this QR code, and take the survey. All right, so you just use your cell phone, use your camera if you have an iPhone, scan the QR code, and it will take you to this survey. Alternatively, you can actually type in the URL this link if you prefer that, and then just start the survey. And I will give probably 1 minute or a couple of minutes until you guys are able to go to the survey question. So again, just scan the QR code, or alternatively go to your URL and then type in this link, and then we will see what everybody feels about this situation that we just presented.
All right, now what you are seeing on your screen
responded.
Oh, yes. So,
Use the wireless mic.
So this is the first question.
okay.
So it looks like it's unanimous that in this situation, oh, okay, it's still updating. I'm sorry. We'll give it one more minute. To the organizers, how many more minutes is left in my presentation? 15. 15. Probably do like a couple and then we'll proceed, okay? Because I don't think we'll be able to finish everything.
Okay.
All right, so I think I'll end the poll. It looks like it's still moving. People are still making up their minds, but it looks like, well, it's dwindling now. 13% feels that the intervention is now, okay, so I guess people are changing their minds. 9% of those participants feel that the medical intervention, the vent or the life support should be pulled, while 93%, 93% of the participants feel that we should respect the family member's decision to keep the patient's decision. The problem with, just to caveat the situation, is that the problem with brain death is that they are not able to keep the patient's status or stability, biological stability, without the vent. And as you know, being in a vent is a very expensive intervention. And I can tell you from working in the ICU several years ago, when I was in the ICU, I know that when we charge the patients, when we charge their insurance, it's about one night in the intensive care unit cost a family member $10,000 per night. So imagine 1 week is 10,000 times what? 7 is like 70,000 per week. So the burden for this situation is really hard to fathom, because now we're trying to advocate for, beneficence for the family and autonomy for the family. But then again, we are violating the principles of justice, right? Because now we are, while caring for the patient in this status, we deprive other patients of their ability to be cared for in the same ICU bed, because you have that patient being cared for. So just a thing to think about. All right, so let's go to the second ethical dilemma. This one is excess embryos. Connie, can you show them the video, please?
Using assisted reproductive technology to make the pregnancy dreams of patients come true, are now facing a new and complex ethical dilemma when it comes to what to do with abandoned embryos.
None of us were really trained on what to do with this. It's a dilemma, it's a conundrum, it's a problem.
During the IVF process, doctors often create multiple embryos, which are then either implanted or frozen for use at a later time. If a couple decides they do not need the remaining embryos, they have the following options. They can destroy them, donate them to research or to another couple, or continue to pay storage fees, which could run anywhere from $400 to more than $1,000 a year. In many cases, patients stop paying their storage bills and stop answering calls, leaving the clinics with what they call abandoned embryos.
If you talk to patients when they're thinking about having a child, nobody thinks that they'll ever discard or abandon their embryos.
Dr. Craig Sweet runs a fertility clinic in Florida. He says about a quarter of the frozen embryos at his clinic have been abandoned. And according to experts, it's a problem in fertility clinics across the country.
Over time, more and more embryos have accumulated that have been abandoned. I know of organizations that have vats of abandoned embryos, and they're afraid to discard them.
It's unclear exactly how many frozen embryos have been abandoned nationwide. Some doctors estimate the number to be in the hundreds of thousands, while other studies suggest it could be in the millions. Adding additional complications to the debate, the fact that embryos are fertilized eggs, meaning they have a potential for life.
All right, perfect. Thank you so much for sharing that video. And then we go to our poll. Let's go back to the polls, and then I would like to ask you guys, what are you going to advocate for this ethical dilemma? Sorry, where is that? Here. All right, so I'll give you a minute to respond. If you are the nurse working in this fertility clinic, and I know there are nurses who work in fertility clinics, right? In America, we have the Planned Parenthood. So if you're the nurse, what is your opinion about abandoned excess embryos? Is it okay to discard them, or should keep them in the clinic indefinitely, or you're not sure? All right, it looks like our audience had made up their minds, and they feel that 21% felt that it's okay to discard these abandoned embryos. Again, those are fertilized eggs, and so therefore they have, especially for religious, individuals, it might present as a, religious issue because these embryos are fertilized eggs and they have potential for life. Then 58% of you guys felt that we should keep them indefinitely in clinics. But then again, who knows how long the clinics are going to be open, right? And keeping them in storage obviously entails a lot of cost as well. So, and then interestingly, 20% still are not sure about how to address this ethical issue. So again, a lot of us here have different opinions, as you can see in the chart. Really, we have different views and attitudes about these ethical dilemmas and topics and situations. So there's really no right or wrong answer. It's just an ethical dilemma that every individual has different response depending on their moral standing and beliefs. All right, so moving along, I think I actually have a couple more videos, but I think it's suffice to just say that every single of these ethical dilemmas, we could go on all day with presenting with different dilemmas, but I think what is common for all this situation is that we as nurses are always in the face of these situations, and it's really difficult, and these predicaments are causing us as nurses some moral distress in our daily lives. And so that's why it's important that we're talking about this as a group of professionals. So let me then summarize the the talk by really examining on what's our role as nurses in this ethical dilemma. Well, our role is basically to determine and to acknowledge that there is an ethical dilemma, right? So we should not really pretend that there's no ethical dilemma going on in our nursing practice. Then it behooves us to gather and analyze relevant information that surrounds the situation. Then we should clarify our values and moral positions. What, as individuals, what is our position? So I know I've worked with co-workers, nurses who are Jehovah's Witnesses, right? So in their beliefs, they are not allowed to administer blood because that's not within their moral context. So as long as you clarify what your beliefs are, then you should be able to refuse, to do those interventions if it does not fall on your beliefs. But then again, you have to make sure that the patient, by refusing to do a nursing action, you should provide a backup or a coworker to do those work for you, right? If you don't want to administer blood because you don't believe in that, you should be able to give advance notice to your manager or to your charge nurse and say, hey, actually I am not allowed to do this procedure. Can I ask my coworker to do it for me? So, and that's perfectly fine, as long as the patient is not put in a difficult situation. And then we determine our options, and then we make our reasonable decisions. Are we comfortable with doing the things that being asked of us as a nurse? And then we evaluate the impact of actions in our outcomes. So those are basically our guiding principles when we are faced with those ethical dilemmas. So the ultimate question becomes, where do nurses stand and where they should be standing, right, in this complex world of ethical dilemmas in healthcare settings? Again, a nurse must be aware of our own moral perspective relative to health issues. So I always go back to the mantra of we cannot give what we do not have, right? So if you do not know your moral perspectives, chances are you're not able to, give a clear, clear indications of what needs to be done in situations. So if family asks you, what do you think what we should do? Again, it's not your role to give answers to those ethical questions, but at least you will be able to have them talk and hash this out so that they can be able to process this ethical dilemmas themselves, and they should be able to come up with a decision, not you. But then again, it takes a strong knowing of oneself to be able to have this intelligent discussion with your patients and their family members. Again, always focus on the patient. What is the goal of the patient? I think it's always good to ask, the family members, what do you think your mother, if it was the mother, do you think your mother wants if he or she was in this situation? What would her wishes gonna be, right? So what you don't say, what do you want in this situation, right? You don't ask one child to say, hey, what do you think should be done to your mother? Because chances are what's the want of one child might be different from the want of the other child, right? So it's not about them, it's always about the patient. Next is that as a nurse, we are obliged to actually provide information and clarify terms to our patient. What does terminal mean? Maybe, our patients are not all healthcare professionals. They probably don't have any healthcare background. So provide to them terms that are, clear to them. What does terminal mean? What does futile mean? Or what does CPR entails? What do we do? How about intubation? Those are the things that we as nurses should be able to clarify to our patients and to family members so that they will be able to arrive at a sound decision, whatever it is that they want. We should also be able to empower our nurses. As nurse leaders, we should create policies that will engage our nurses to take charge and be able to speak up about ethical, dilemmas in our own workplace. They should not be afraid, right? Because there are situations where workplaces are too harsh that nurses are afraid to speak up. Our policies should be transparent and should be able to encourage nurses to actually advocate and be leaders in their own right to speak up and advocate for the patient. And there should be no fear in speaking up. And we should all collaborate with healthcare teams and administrators to create new policies and guidelines. As I've mentioned earlier, other professions should not speak up for us as nurses. Your physician group should not be able to dictate what we nurses feel should be done, right? We should be on the table. We should be creating policies that we think are right for patients. We should be able to interpret guidelines, and we should not be, pushed by other healthcare groups. I don't mean disrespect, but we should be able to advocate for our own practice as professionals that are equal and at par with other healthcare professionals. It doesn't matter if you are a physician, if you are a physical therapist or a pharmacist. We as nurses are the biggest group in the healthcare practice, and we should be able to advocate of what is right for ourselves and what is acceptable to our practice. Nurses should be able to utilize organizations' ethics committee for complex issues. So if you feel there are some situations that it's really complex, nurses should be empowered to really escalate this to an ethics committee in your hospitals. And so that in doing so, you're actually advocating for your patient. And the ethics committee consists of different healthcare professions, and the committee, just so you know, does not provide answers to the people or to the patient or family members. They merely present all the different scenarios and outcomes of their decisions so that they will be able to arrive at the decision that they are comfortable to live with. And the thing is, ethical dilemmas are actually it lasts for a long time, right? It does not limit itself to the outcome within that person's experiences in the hospital. It impacts their lives forever. So your decision about advanced directive now, could be felt by the children of that person later on in their life. So that is why it's a very important opportunity for the patient and family members to discuss ethical dilemmas, because the impact of that will be really protracted. And nurses should apply to the organization's ethics committee. So I actually, it's a big thing about encouraging my nurses or the nurses on the unit to really participate in organizational ethics committee, because I think it allows them to, speak up and to learn from other professions, and also hear the voice of the patients themselves. And they learn a lot from participating in these ethical discussions in these committees. And my final word for this talk is that there's no clear answers to ethical dilemmas in clinical practice. I keep saying that. But our role as nurses must be an active member of interprofessional care team, and we should be able to identify ethics-related situations, work with others to address these issues, and we should always provide holistic support for patients, our families, and our colleagues. And with that, I would like to end my presentation, and I would like to leave with my again, thank you to the organizers for inviting me, to the listeners for paying attention in this our presentation, and also my contact information in case you need it. So at this juncture, I'd like to open it for discussion.
Okay, thank you very much, Dr. Josper L. Tularba, for that very informational topic about the dilemmas and ethical issues that we are facing as nurses right now. So you have discussed, to wrap up on the presentation, you have discussed about the the guides that guide us somehow on how to make ethical decision-making process. Like for example, we are having following code of ethics, scope of practice, or our own personal views. And one of the things that you mentioned in your systematic reviews was the number one ethical issue that nurses are facing is on the end of life issues as well. And Dr. Larba also mentioned about the roles of nurses, especially on how to overcome these ethical dilemmas. So yes, doctor, we have questions here from our participants via the Facebook Live comment section. Okay, so but before I ask that doctor, I know that there are no right or wrong decisions, as you have said, with regard to these ethical dilemmas. How will you be sure, or how will be able to resolve an ethical dilemma, for example? How would you know that you made quote unquote right decision?
That's an interesting question. As I've mentioned, there really is no right or wrong, decision in terms of ethical dilemmas. However, our role is really, to make sure that we feel assured as nurses that we advocated for our patients. We actually communicated to the family members so that they be able to have the answers that they need and even provide or communicate with them the things that they don't feel they need, but as nurses we should be able to explain to them. And in doing so, when we know that we have provided them with the information that they need, we clarified terms to them and then guide them about the outcomes of their decisions. Then we can be assured as professionals that we did our best in the situation, but ultimately the decision rests on the patient or the family members.
All right. So you mean to say that we act as an advocate for them?
Absolutely. Okay. We do not. Again, newer nurses actually. I have experienced newer nurses on the floor because of lack, of experience, and that's not their fault, obviously. But sometimes they find themselves in a predicament where they've told family members or a patient to do one thing because they think that's the right thing to do, and then later on family members come back to when I was working as a supervisor in the hospital, say, but then this nurse said that this is what we need to do. And I always go back to the nurse and say, let's talk about this, let's process what just happened. Remember, these are ethical dilemmas. You do not choose for the patient. You can only present this information to them, but there's no way that you should be the decision maker for them, because then that puts you in a very bad situation. You can just advocate for them, give them information that they need, but ultimately it will be the decision of the patient and the family.
All right, very clear, doctor. Now, Dr. Jesper, if you don't mind, can you tell us about the most significant ethical issue you have encountered in your professional journey, for example, and how did you respond, or what did you do to address it?
You don't want me crying today, right? But yeah, this keeps bothering. There's several experience working in the ICU. I have had my share of ethical situations, and up to this day, remembering them just keeps also bother me as a person. I remember taking care of this 97-year-old lovely lady who otherwise was healthy, and all of a sudden has a small bowel obstruction. Like, the only option, as for small bowel obstruction is to go to surgery. But then the physicians and the surgeons gave her the choice that when you go for surgery, there's no way that you will survive under the knife, under the table, for the surgery to correct your bowel obstruction. You're 97 years old. So she, I've been caring for her in a week, and it's difficult to explain to the patient that this is the only choice that you have, a surgery, but you're not eligible. Otherwise you will, just actually die. But then again, the other option is really no intervention, which is letting her starve, because obviously she cannot have any nutrition. So the only way I could is actually to advocate for the patient for hospice, right? So as a nurse, I have the responsibility to, talk to the patient, listen to her, anxiety, because, being faced with a dilemma of dying soon from hunger, and what are the options for her so she will have a, um, you know, respectable last days of her life, and what hospice is. Those are the information that is needed to us when we are in those situations where the only option is actually hospice, and we should be able to explain that to our patients. So in this case, she's crying. She's 97. I felt for her. But then knowing that I was able to provide her with information about hospice and actually gave the referral to our hospice care, and then she eventually, went back to spend the rest of her life at home with her loved ones, was, gave me some comfort that she was able to die peacefully.
Okay, so at least you have done your part as a nurse in terms
Yeah.
of the situation.
And I'm sure our audience have their own share, probably, um, more poignant as my experience. And, we all, there's no way as a nurse that you will not have your own story to tell. And it's just important that you have your own, you know, belief, good belief system, and your morals, so that you do not have a lot of moral distress when you go home.
Okay, well, thank you, doctor, for that. Actually, I have a lot of questions for you, but because of time constraints, we will be receiving that maybe on future sessions, probably.
Sure, okay. And I have my contact information listed on the screen, so if they feel that they would like to talk and discuss further, you can feel free to give me a call.
Very well. Thank you, doctor. And that was our last question for Dr. Talarba. It was really informational, and we are really inspired by the discussion. Okay.
My pleasure. My pleasure.
At this point in time, let me welcome the Dean of the Philippine Women's University School of Nursing, Dr. Minerva de Ala, and the faculty in charge, Dr. Nicolo Andrei Anonuevo, to award the certificates and tokens of appreciation to all our speakers. May I request Dr. Anonuevo to award the citations to Ms. Laureline Parsha and Mr. Jerome Okiana, and for Dr. de Ala, for Dr. Jasper Talarba.
So good afternoon, everybody. I have the great honor to award the Certificate of Appreciation to the following students in the PhD in Nursing who serve as our speakers for today. So allow me to read the citation first. Philippine Women's University, Graduate School of Nursing, Doctor of Philosophy in Nursing, hereby awards this Certificate of Appreciation to Laureline Parsha, MA, RN, for sharing her valuable knowledge as resource speaker during the conduct of webinar entitled Nursing Policy and Ethical Dilemmas, where nurses stand and where they should be standing. Given this 6th day of March 2021 at the Philippine Women's University, Manila, Philippines, signed by the overall chairman webinar, Arce Amparo, MARN, myself, and the Dean of the School of Nursing, Minerva de Ala, EDD, RN. A warm round of applause for Laureline Parsha. So at this point, the same certificate is being awarded to Jasper Toralba, or the same certificate is awarded to our second speaker, Mr. Jerome.
Well, I think there are some technical problems we are experiencing, but at this moment there are certificates posted now on your screen For our participants right now, please be informed that you are still tuning live to this activity. So right now we are giving our certificates and tokens of appreciation to our speakers. The evaluation link shall be posted shortly in the screen, on your emails, as well as in the Facebook comments section. Okay. So once again, on behalf of the organizing committee, we would like to inform you that if you have any questions that were not answered in this activity, please feel free to post that in the comment section of the Facebook Live, because we will be entertaining it in a while. Okay. So we have learned so far about nursing informatics, about the ethical dilemmas in nursing policies and in the profession, as well as the ethical issues or ethics that we are doing in times of pandemic. If there are, for example, a scarcity of resources, what should we do? So I think we're able to answer that one. Okay, so right now, let us proceed to the awarding of the certificates and tokens. Dr. Anonuevo.
So at this highlight, of course, we would like to award the Certificate of Appreciation to Jerome Okina, MANRN, for sharing his valuable knowledge as a speaker, resource speaker, during the conduct of a webinar entitled Nursing Policy and Ethical Dilemmas, where nurses stand and where they should be standing. Given this 6th day of March 2021 at the Philippine Women's University, Manila, Philippines, signed by the overall chairman, Arce Amparo, MARN, myself, and our Dean, Minerva B. Ala, EDDRN. So again, a warm round of applause to Jerome Okina.
Well, at this point in time, let us call the Dean of the Philippine Women's University School of Nursing, Dr. Minerva D. Ala, to award the certificate to our third and last speaker.
Thank you. Good afternoon, everyone. The Philippine Women's University School of Nursing hereby awards the Certificate of Appreciation to Dr. Jasper Tolarba for sharing his valuable knowledge as a resource speaker during his conduct of webinar entitled Nursing Policy and Ethical Dilemmas, where nurses stand and where they should be standing. Given the 6th day of March 2021 at Philippine Women's University, signed Mr. Arce Amparo, the overall chair, Dr. Nicolo Andrei, the professor in charge, and yours truly, Dr. Ala, your Dean of the School of Nursing. Congratulations and thank you, Dr. Gasper.
Thank you.
All right, congratulations to all of our renowned speakers, to Ms. Loreline Parsha and Mr. Jerome Okiana, the PhD students, as well as to Dr. Jasper Tolarba, and of course to our Dean, Dr. Diala, and our faculty in charge, Dr. Anonuevo. Thank you so much. And that's it, ladies and gentlemen. Indeed, the sun is about to set, yet we are all expecting for a brighter new morning to come. This metaphor is likewise true to our learning situation. We might be tired from today's activity, but what we have learned today, intellectual gymnastics, is looking forward to being applied in the context of our profession. Our profession that needs to adapt and be wary of its implications to and for the improvement of our patients and our society. But before we close the webinar, we would like you to look on the people who, in one way or another, made this event successful. Let's watch this video. And to formally close the loop, let me introduce to you the Nurse for Cancer Programs at Primary Healthcare Corporation and the overall co-chairman of the organizing committee, Ms. Queen Jegulin Yanga Abdallah.
Mr. Marco Alfredo Benitez, the Philippine Women's University President. Dr. Felina C. Young, Chancellor, Senior Vice President for Academic Affairs. Dr. Minerva de Ala, Dean, School of Nursing. Our noteworthy and honored resource speakers, Dr. Jasper Talarba, Mr. Jerome Wakiana, and Ms.
I think Ms. Queen.
Laureline Portia. Faculty members, students, colleagues, and friends around the world, a pleasant day to all. Nursing informatics and healthcare go hand in hand these days. Electronic health record is only one aspect of nursing informatics. And it is inherent to nurses to uphold patient privacy as a legal obligation. Information technology is a prominent tool in healthcare management, and nurses should be the vanguard in addressing the concerns about privacy, confidentiality, and integrity of information. In the era of massive uptake of technology, that has resulted in the digital age of healthcare delivery. The high burden of COVID-19 pandemic has resulted to scarcity of healthcare funds, including limited personal protective equipment, and issues with patient prioritization. Therefore, nurses should be adequately prepared to deal with ethical challenges among high workloads and limited resource conditions, because ethics are critical to quality nursing care. The field of ethics addresses how we should treat each other, how we should act, what we should do, and why. Defining what needs to be done can sometimes be hard. This is where nursing ethics can be a way of determining what is correct and incorrect. Ethical decisions are ethical when it is consistent with generating and maintaining trust, showing respect, responsibility, equity, and quality. As we come to an end, let me share words from Albert Camus, and he said, "A man without ethics is a wild beast loose upon this world. It can be surmised that in the absence of ethics and morality, one descends into corruption that impacts not just the individual, but also those who surround them." Before I formally conclude this event, I would like to commend and thank the PhD in nursing, both in Qatar and Kuwait students for the extreme effort and determination in making this second leg of our webinar successful. Led by the chairperson, Mr. Arce Amparo, to the Webinar Working Committee and the chairpersons, to the PWU Graduate School for this opportunity, and lastly, to the PWU ICT and multimedia staff for their relentless support all throughout this undertaking. Once again, thank you very much for watching and taking part on this virtual event. I hope to see you again in the future. God bless.
Okay, well, thank you, Ms. Green, for that. I know that you have said that nurses should be able to face the challenges, whatever challenges it is, even in this webinar activity. But what's the most important thing of all is that they're able to face the challenges in an ethically sound manner. Thank you. Please be reminded that the evaluation link has been sent to your respective emails. Right now, as shown in your screen, there is a QR code. You may scan that one as well. And there is a QR code and link that is also posted on the Facebook Live comment section. We would really appreciate it if you could answer the survey within 24 hours, because it takes about 3 minutes to answer the survey or the evaluation of the program. We will be sending your certificates within 3 to 5 days after we receive your evaluation. So we all have arrived at the conclusion of this activity. On behalf of the organizing committee, spearheaded by Mr. Arce Amparo and our faculty in charge, Dr. Andrei Anonuevo, I would like to thank you for sparing your time and effort in this activity. Let us all disseminate the learnings by sharing this activity to your colleagues or friends in the academia. And forget not to practice the learnings as necessary. And this has been Nursing Policies and Ethical Dilemmas, where nurses stand and where they should be standing. I wish everyone a wonderful and dilemma-free evening. And as we end, let us all join in the singing of the Philippine Women's University hymn. Until time meets us. See you.
Praise
this activity, and see you soon. Goodbye, and have a nice night.